going to be covering a company, a biopharmaceutical company that could explode at any time soon. Will it explode in the future? We'll soon find out. These guys focus on breast cancer and COVID-19, so stay tuned to watch out for more. So guys, the company we're covering today is Atossa Therapeutics, ticker symbol ATOS. At the time of recording on the 4th of February, the price is at $4.40. Uh, has a market cap of 314 million and is slowly increasing in price over these last few days. We've seen it's come just under over $2, and we're sitting at this price today, so it's more than doubled in just a few days. So let's have a look and see what this company is all about. So currently this company have two COVID therapeutic programs under development. Okay, one for the severely ill patients on ventilators and one for home use. Also, they have an ongoing project or research into a drug called endoxifen, which is used to reduce breast cancer, basically. Okay, so it's to reduce the tumor activity in the breasts of women. So, according to statistics, approximately 1 in 8 women and 1 in 1,000 men will be diagnosed with breast cancer during their lifetime. Every 2 minutes in America, for example, women are diagnosed with breast cancer. 40,000 of them die each year. Okay, so this is a quite an exciting program, and it looks from what I've looked at recently, this could be quite exciting. So let's go straight into have a look at this program. So covering the two projects or the two uh, projects they have, developments rather, on the COVID side. They got the first one, which was introduced in April 2020, called the COVID-19 Hope. And basically, this is a therapy to improve lung function and to reduce the amount of time that patients are on ventilators. Okay, so this has actually been approved by the FDA, which is good. And now their real main plan or their ambition is to get this out onto the market as soon as possible. Okay, and then on the other side, the other development they have is a nasal spray, but that's actually undergoing trials at the moment, so there's nothing on that one yet. So the other development side is the breast cancer. So there's breast cancer. They have an extensive knowledge of breast cancer. They've done a lot of research on this, and they say that the factors that can increase breast cancer are poor diet, like for example exercise, certain genetics, if you're genetics, and also dense breast. So these are the sort of three phases or the three factors, should we say, that contribute to having breast cancer. So it goes down further to look at the risk mitigations, etc., etc. So that leads us on to look at the endoxifen, and this endoxifen is the drug which has the potential to work in these three phases we're talking about. So it can be introduced to any one of these, whether it's genetically or whether it's breast density. So the idea is this can actually mitigate breast cancer. So what it does is, in the first instance here, it prevents the density of breast tissue. Okay, so it reduces that. It also reduces cancer cell activity before surgery, when surgery needs to be done, and to reduce the risk of reoccurrent or new breast cancer after initial treatment. So this is really quite promising because there's nothing else like that on the market at the moment. Now, before going any further, I just want to. I normally leave this to the last, but I think this is quite important now that we're here because the man behind the scenes, which is the chairman of the board and the chief, the CEO, is Stephen Key. Okay, and this guy has a lot of experience. In fact, he's the inventor of 87 U.S. patents. He's 130 pending at the moment, and he's the inventor of patents covering 5 pharmaceutical products that have been approved by the U.S. Food and Drug Administration. So again, promising. We always need to look at the board of directors, the management before we go and invest in the company. And if you have a look at the details, his past and his experience, his knowledge, you can probably guarantee that something's going to come good out of this. And now, being a penny stock, there's always risks. Now, this is a company that's in its developing stages, so the company doesn't actually have any revenue. Okay, so we can't calculate any price to earning ratios, for example. But we can see that they don't have any debt, or as of the 30th of September 2020, which is the last reporting, the last time they reported results, they had no debt, and they had a cash flow of 81 million plus 9.2 million dollars. Now, looking at the free cash flow, we want to have a look at how that has been handled. Okay, so the free cash flow, or as in stated in September 2020, it had zero debt and a cash worth of 91 million. Okay, so if you have a look at the last year, they actually burnt through 11 million dollars. Okay, so that's like the equivalent of 10 months of burning cash of 2020. So that's called what we call a short cash runaway. So when we see situations like that, we need to make sure we see the company that's either replenishing their cash, okay, or having some funds from somewhere. So otherwise, it's a company that cannot survive. So they need to have money coming from somewhere, and we can see this in this graph. For example, when we look at their equity and their free cash flow, it can be a little bit of they could get to a point where they could actually run out of money, and that's where things start to get worrying. So so yeah, there's actually no signs at this moment of any revenue coming in, so they don't have any money coming in. So you just want to be careful how this company handles their future. So what would I suggest? What would they need to do? Well, they probably would need to do a merge with another company, right? To be able to raise funds to move forward. Otherwise, this company could go out very soon. So let's go into the exciting news. It's the news that's come out just a couple of days ago. This is the reason why there's a lot of price moves and a lot of volatility in this company at the moment. They've come out and I'm going to actually dictate what it says here. It is a welcome event to an ongoing clinical trial because the results are so overwhelmingly positive. Okay, so the data from the first 6 patients they've done a study and it's actually been halted. Okay, because the results are really that positive. So I don't know. I'm not a scientist, but I'm thinking like 6 patients only, and they're sort of advancing that forward. So this looks like it's a big breakthrough, because according to the studies, it shows that 74%, there's a 74% reduction in key 67. So key 67 is the measure of the tumor cell in the breast. Okay, and at the time of the surgery, which is the other phase, which is the second phase, if you remember from the diagram we saw before, they had key 67 levels lower than 25%. So this is an important threshold to improve the long-term survival as identified in studies by others. So with this being said, this has actually saved a year. So this study has actually saved a year on the actual on the project they have. So it actually allows them to accelerate their clinical development in the United States. So they're now going to go to the United States and continue to do those developments. Okay. So the other bit of news is they've announced there's a 2-year update of the FDA-approved expanded access treatment with endoxifen. Okay, so they've also reported that the client, or the client, I say the client, the patient has not had a recurrence of breast cancer according to these studies. So yeah, so everything's looking good. This is really quite good for the future. So the other good bit of positive news with this is how, unlike another drug that there can be used, there's no side effects, okay, associated with the drug. Well, there's nothing been reported so far, and this is quite encouraging. So this has been a good experience for the patient has had a good experience over the last 2 years, and her experience serves as a model for ongoing development efforts. So this looks promising. In general, is promising. There's some good results coming from this. However, there are a couple of concerns. When in fact the two concerns are a little bit of what I've talked about is the cash free flow, so the amount of cash they're burning through. So it would be good to see in the future that there's an emerge, or whether it be with a SPAC or another way of raising capital uh, by an investment company, where they'll be able to raise money, much more money to go forward and to further develop their research. The second thing that worries me slightly is the history of their dilution of shares. So they have a tendency to do that. If we have a look back, they're constantly diluting shares. So this for the the investor, it's all right doing it once or twice, but this it seems to be uh, quite a common thing that they've been doing over the last few years at least. So this is good because I suppose it raises raises capital, but I personally don't want to have my shares being diluted every year. So yeah, it's a bit of a concern, and it's something to think about. So, do I invest in this company or do I not? To be honest with you, I'm investing in this company at the moment, and I'm investing it as a trade, okay, as a short trade. I'm up around about 50%, 45, 50% at the moment. So I have a price target of $6. And what will I do? Will I hold it for the long term? I'm not 100% confident holding this for the long term. I want to see something that's a little bit more promising, and that promising would be related to the 2 points that I've just said. So yeah, watch this space. Let's see what we can do with this in the future. Okay, guys, so that's a bit of an update on this company. I hope you enjoyed the video. If you enjoyed the video, please give me a big thumbs up, and please remember to help my channel out by hitting the subscribe button. That really helps my channel to grow further. Okay, guys, have a great day and speak to you soon.